So yeah, I said it'd be really nice to have a chat together about this, because I know we all get really excited when we're talking about mother point acupuncture, because for me, and I know for you as well, it's been a kind of game changer, and that's really like the word that anyone who's done this training always says, like just getting those faster results, in better results, more reliable results, and things like that for all kinds of pain. So yeah, it's been really.
Yeah, yeah, I totally agree. I mean, stuff that I would spend sometimes, I don't know, 4, 6 sessions on, I'm getting, the results in one session, and it's the patients. I mean, obviously it's great for me because it opens the clinic up, but it's phenomenal really what it can do, and the clients love it mostly.
Yeah,
It's
the
weird.
time it saves them coming in 2 or 3 times instead of, and then a couple of, every now and then for a bit of maintenance versus coming in 6 times before they see results. So yeah, it's really a win-win. It's yeah, all round, it
Yeah,
definitely brings in more referrals for based on that as well. It
yeah,
brings, a lot more.
absolutely. And many of them, although they find generally what we do, many of mine call what we do weird. They find the motor point stuff, they call that even weirder because
Weird.
they,
It's so weird. But do
yeah,
the zappy thing.
yeah, yeah. Are you
Yeah.
going to electrocute me today? Well, only if you're
I'll try not to.
nice.
Yeah, it's cool though. It's but when we get it right, sometimes we get that muscle just right. It's just it's a good feeling.
Oh, yeah, it's. I haven't stopped being excited every time it happens. And you're like, oh, it's the sweet spot that you just go
Yeah.
and you go, yeah, that's
Yeah.
it, that's it. And
Absolutely. Absolutely. And with all the sitting people are doing, it's a lot more sitting happening now. So we're finding the back pain, the lower back pain, it's coming from that. And it's just I see some questions coming in. Sorry, we'll come back to the questions in a minute. Just yeah, so we'll try and get to those as well because they keep disappearing. Sorry, this is the first time I've done it live as well, so it's all new. But yeah, so what's called the lower cross. So we're talking about tight muscles and weakened muscles, and being able to correct that for people, and getting them to then do the exercises after. Like once we can strengthen and correct that dysfunction, then the exercises can be really effective, and then they don't
yeah, and
increase.
clients, they understand the concept of that when you
Yeah.
explain to them that actually when these crosses that occur, that you're having shoulder pain because of something lower down, or in reverse, they get that. Whereas sometimes I think when you're talking about fascia and the connection with fascia, sometimes that seems to be more difficult for people to grasp. It might just be the way I'm trying to explain it, but they get this zigzag thing that can go on in the body, and when they see how quickly you can sometimes resolve their problems or reduce their pain or improve their function so quickly, they get it.
Yeah, they do, don't they? No, it's great. It's great. And so along with that, then yeah, like you said, shoulder as well is another big thing we're seeing at the minute. Shoulder going up into the neck, going up into the head. So being able to resolve those for people as well. Seems like
Yeah,
everything's landing on people's shoulders at the moment. Shoulders are coming up like this. It's never
yeah.
the
I
same.
mean, the lower back thing has always been a problem,
Yeah.
from too much sitting, but definitely the last year that any acupuncturist has seen a huge spike in
Mm,
uh, in it, because people don't have their lovely ergonomically designed desks. They don't have their lovely chairs, and they're balancing things on ironing boards, and you can only do that for so long,
yeah.
and
Oh,
the body suffers, and
yeah.
so yeah, we're all seeing it, and we're all grateful to be able to treat it. um it was Gloria wanted to know whether motor point acupuncture is similar to Yuan Shi acupuncture, which Suzanne Robidoux teaches. Gloria, I haven't done that Yuan Shi course, so I actually can't answer that question.
Yes,
I'm
same
afraid.
here. Actually, I'm not familiar with that technique either. And I know
Yeah,
you've trained with Suzanne, haven't you, Nicola, with the herb?
yeah, all for herbs, but I haven't
Yeah.
actually done any of her acupuncture.
We'll have to
Um,
look into that. I'd love to find out more and see what compares. I mean, there is overlap. Like when we're talking about what are we talking about with motor points? So we're just I know at the moment we have acupuncturists tuning in. We have potential people, people that are familiar with us, both of our followers. So we're talking about the neuromuscular junction really is where we're going in, and that's why the muscle moves when we apply a very small, it's a very small current. I know we were talking about electric. It's really small. It's at 10 hertz or 2 hertz depending on what we need to do. And you're talking about moving the muscle, so there's at least one in every muscle. And then there's an overlap that sometimes it's right, you're describing the location, it's right on an acupuncture point, and then other times you're talking about a belly of a muscle. So
yeah,
there's
and I think that there was a confusion, I think, with some of us. Well, for me to start with, because I've always done trigger point work as well,
yeah,
and you think
yeah,
just guess trigger point is going to get the same effect, and actually, we very quickly realize that it doesn't. And when you're, getting a trigger point can be absolutely brilliant.
game changer as
But,
well. Yeah.
but we also know that that can be very, very painful if it's applied incorrectly. I mean, I've had trigger point acupuncture from therapists, and it has literally left me sobbing with pain
Mm.
because it can be so brutal if people aren't considerate.
Yeah.
And so trigger points are amazing, and when you then go through that trigger point and go just that little bit further and hitting the motor point, and yeah, you can have that bit of sensitivity and a bit of discomfort the day after, but it's nothing like
Mm.
when you've had a whole session of trigger points, which is, for some people, that could be the them never having acupuncture again.
It's true. It's so true. And like what I've been finding is we'll get most of it with the motor points, and then there's one or two trigger points that remain, and then you'll go in when if needed and get those trigger points, and you can go very lightly as well, and it doesn't have to be horrifically painful. That's the difference between going to an acupuncturist that's familiar with trigger points and going to somebody who's only done trigger points and they've only learned it the way that it's that, oh, we're going to hurt someone now, and it's
Yeah,
not
there seemed
exactly
to,
ideal.
yeah, there seemed to have been a whole era where it was, if you don't hurt your patient and they don't, are crying out in pain, that you're not doing the job
Not doing
properly. And then that also goes for massage. I trained originally, and it was,
Yeah,
if it was no pain, no gain, and actually let's face it, it's bullshit,
yeah,
really.
exactly. We can throw that term out anyway because with motor points, if we there's often an adjustment is needed. It's like, oh, if that's pinching you, we're going to start. We're going to adjust that needle, and now it's not pinching you. Now we're getting it. Now it's working correctly. And now we're going to
Yeah,
get results. And then
yeah,
you know once then we test, because we're testing function of muscle, so we're testing after treatment, and you see the difference. Difference is clear for a person. You know.
yeah, yeah. So I mean, I found the learning it, and I think we both learned from Rich Hazel, who
Is yeah.
I'm I'm absolutely indebted to it. My brother's just put up a very snidey comment about why I still hurt him,
Because
you because
it's my brother. Yeah.
because I love you, and sometimes it's the only way I can get you back for the years of torment.
Perfect.
So, but yeah,
I'm the only child over here, so I have no siblings to torture.
yeah, he had to get a word in somewhere. Hi, John. Hope you're okay. Yeah, but no, I mean the way that the nervous system acts as well when you're doing motor points is fascinating, and turning that pain off,
Yeah.
and it happening so quickly,
Mm.
and it's people walking in with huge amounts of pain and walking out without any
Yeah.
is a massive testament. And as I was going to say before John interrupted me, is I'm indebted to Rich and his teachings, and
Yeah.
also Dan Dominguez as well, for what
Work.
their
So clear.
generous
Uh,
teaching.
yeah, such generosity, such clarity. You know, if you don't get it, you know, straight away, no, this is yeah. But you get nearly get it first time always anyway, because yeah, they teach very clearly, and yeah, what they do works. And it's another testament to this work is that Dan Dominguez, who you mentioned, he's team acupuncturist for the Buffalo Bills over in Buffalo, New York. So
Yeah,
that's a really big thing as well.
so
And
cool.
yeah,
Team acupuncturists. We need more of that over here.
I think it's yeah at the moment like it's well known in America, but you know this side of the Atlantic, you're in England and I'm here in Ireland. It's kind of the best kept secret at the minute, but you know that'll change. It's going to change very soon. You know the word is
Yeah.
starting to get out. So
There's a great core group of acupuncturists doing motor points,
are
and we're all so passionate about it, which is what's lovely. Those of us that work with musculoskeletal conditions, yeah, it's brilliant. So um, yeah.
Are there any more questions? Can I scroll back and see these questions here? Oh yeah, I can. I'm just scrolling back up to see. And it's telling me lots of people joined. Nice. No, there's no other questions, but I'd
Well,
say
I can see
if
a question about tinnitus.
oh yeah. Where is it? I don't see. Oh yes, I
What?
see it now. Yes, briefly about acupuncture and tinnitus. Yeah, tinnitus is one of those ones that it's one of those ones that like about half the time you don't get quite as good results as you'd want to, and then other times you get really good results. And we some of my friends had used the motor point acupuncture. They had used some local points and found that really good. So I have been incorporating that in recent months and getting variable results, to be honest. So it's still a
Yeah.
case of, you know, it's worth a try. But I it's one of those things that it's not like when someone comes in with their shoulder pain, you say you can fix it.
No, and I
You can
think
try. It's worth trying.
tinnitus is a yeah, tinnitus is a really complicated one. It's, you know, you really want to know why it's
Yeah,
there. I mean, if you were,
yeah.
um, you know, our age group and older, we spent an awful lot of time at nightclubs standing next to speakers,
TV.
and when and when you've got damage to the eardrums and you know tinnitus caused by that or a trauma, it's I think personally my experience nigh on impossible to affect because there's deep damage. But tinnitus can also come from neck tension, jaw pain, jaw tension,
Yeah.
um, and you know, but for some people, you know, releasing the around stomach 7, the masseter, and um,
There's the
you
one
can also
behind
do
here as well. They're all
temporalis and
temporalis and auricularis.
yeah, that for some people that can make a difference. So I'd say, you know, it's worth a try. But you know, if you've got an underlying condition that there's actual damage, then you know
It's
it
hard.
may not resolve.
Yeah. It's a tough
Yeah,
one because it can get really annoying for people.
yeah,
People describing it to me, yeah.
yeah. I think there's a lot of research being done on white noise as well. So people that have tinnitus that can't be helped in the way that we would like to, using that with a white noise recordings at night, so that I've had a few clients that use that and say it takes the edge off, which is a relief for them.
Let's look into that actually. That's good to know, just to have something to tell people when they're inquiring because oh, you're welcome there. I'm just
Yeah, yeah. No,
yeah.
it's a hard one. It's not one of my favourite things to treat. However, headaches, absolutely.
Yeah. I've been seeing a lot of headache in clinics the last 3 months, and from speaking to other acupuncturists, they've been saying the exact same thing. So we've been going at it with traditional acupuncture and releasing because as soon as we touch the neck is like rope, you know. So we've been releasing a lot of neck and head points as well. So no, it's been good because we've gotten results as well. So yeah, so that's another thing.
Yeah,
But
yeah.
if
The
there is
TMJ, I think I don't know about you, but
TMJ,
I've seen an increase in TMJ, and then you're talking to patients about, well, actually, if you've got a tight neck, then that might cause you TMJ, and the TMJ is causing you migraines. But also, if you've got a tight jaw, that will then cause a tight neck, and it's sort of this triumvirate of
it's all
confusion.
connected.
Yeah, yeah. But
Sure.
yeah, it's really important to treat that. I like treating, just a side thing, I like treating TMJ with massage as well. I think there's some, I go to somebody who does internal mouth massage, which is the weirdest. I mean, we talk about what we do is weird, but having someone sticking their thumbs, you know, into the back of your mouth and
Yeah,
massaging muscles
I just send them off with a video. Anthony Lombardi has a really good video. So I usually, when people have been into me, link them that, and at least they can, you know, they can do it themselves then and in their own time, and they can play the video as they need, and you know, go from there, and then combine that with the acupuncture so that
yeah,
helpful,
yeah,
because you know I'm yeah, it makes, you know, it can make people uncomfortable if they come for acupuncture and they end up with that, you know, because I know sometimes some acupuncturists provide it as well, you know, based on that. But
yeah, yeah,
yeah, but if
absolutely.
it works, that's you know, it's worth trying if it works as well, and it sounds like it works for you. Yeah, so that is,
Yeah, horses for courses, as they say.
yep, that's it. So we said we keep this short, so and we kept going there for a good few minutes. So I would say we might wrap it up here if there are no
15
more.
minutes, yeah.
Oh yeah.
Should we just show people, because people haven't actually seen the machine that we use?
You know what's terrible is oh yeah, great. I was like, I didn't
There
bring
we
it
go.
home. There it is. I have the exact same one, because there's sometimes a
Yeah.
little bit of a fierce debate about which model is better. Should it be the original? Should it be
Oh
the
yeah, sure.
LT? But I think this is the best one,
Yeah.
what I've seen, and apparently this one lasts longer as well than that newer model. So if there are
Yeah, I
people out
just,
there that haven't bought them yet, I would say I recommend this, because you can change the hertz. You can use 2 hertz. I like to use 2 hertz for psoas and for face points, and then you can go back up to 10 for everything, for nearly everything.
yeah, I think the last time I saw Dan, I mean, he was using 2, then going up to 10, and then going back to 2 again, just to you know,
Ease into it. There's
phone
not
it in.
much of it. Yeah, that's a good way to do it as well. Is that
But
the
I'm
Zappy
just,
machine? Yeah, that's the Zappy machine. I just see the
there's,
question down here. Yeah, zap zap. No sound though.
shall I just do a really quick
Do your
demonstration?
do your arm. Yeah.
Yeah, let me grab a needle if everyone's
Great.
happy with that.
Yeah.
So
Thanks, Nick. How do you use the machine? So we're gonna show you now. So it's pretty straightforward.
actually, do I need to stand up?
Uh,
Maybe so you can see my arm.
see, are you facing? Yeah, I
So
can
I'm
see your
gonna
arm
try.
now. Yeah.
I'm just gonna needle. I might have to, if I've not got the right bit, I might have to redo it. So can you see the needle there?
You can see the needle. Yeah. So
So what I'm doing is that I'm just turning the machine on,
we start down,
and
bring it close. Now,
hang
when we
on.
work on a patient, we're pressing our non-dominant hand down to bring us in more close contact to the motor point itself. But when it's your own, you know, we still can just about do it as well when we're practicing on ourselves.
It's not doing it.
Just about. Oh, it's
I
because you
need
need
to
that other hand.
re-angle.
You need a
Not,
third hand now.
not getting it.
Yeah,
Let's
it's not
try.
always easy, but when you get it,
Oh, there we go.
There we go. Yeah, I can see that
So,
now. Yeah. So
so the whole hand
yeah.
is, you can see that now.
Can see it clearly. Yeah. So you see that,
Yeah.
and you'll
And
see
then I would
it in your
turn that
muscle.
up to about 10.
Yeah. And now faster.
That's the faster one. I don't know how easy that is to see. I'm sorry.
Yeah, it's okay. We can see it.
You can see the shaking.
Yeah.
And then we just go back down to 10.
I just see people I know joining. Hi.
Go. So that's that
Excellent.
one. Let me go and just put
Thanks.
my and it, you know, there's no discomfort with that mostly. I mean, it just feels weird. It feels like you're being tapped very firmly, and it's kind of like this, or very fast, but it shouldn't be painful if you have it done. I don't know about you. Usually if I say to a client, if they feel any kind of zappy sensation, they need to say, because we can't always feel it.
Yeah. Yeah.
As we're doing it, we're touching the skin, and we're basically making the circuit,
Mm.
and you can very quickly feel whether it's quite right, and
Yeah.
tiny little adjustments of the angle or the depth
To get it quite right.
it
So
then get the
tell the,
sweet spot.
so we always say,
Yeah,
oh, tell us what you're feeling. If it doesn't feel right, that one small adjustment of the needle, we'll get it right then, and that's when we'll get the results. That's when you make the change and you resolve
yeah,
the pain.
yeah. So
Oh, yeah.
frozen shoulder,
Shoulder.
yeah, potentially. I mean, if you can release all the muscles around the shoulder as well as through pectorals, you're doing all the rotator cuff. Absolutely fantastic to get in underneath as well. Again, it's how long it's been there. If you've got somebody who's come with a frozen shoulder for a year, you're going to be in for a bit more than one session, absolutely, because it's so stuck. And but you can, if people realize it's happening and come in, but that I would combine that with traditional acupuncture as well.
Yeah. Good old stomach 40. Like, can't go wrong.
Yeah, and getting people to move the shoulder as
Yeah.
much as possible, and not to put ice on it.
Nice.
Don't use
Let's get
ice.
pushback with when we say no ice, but we say no ice still.
No ice.
No ice.
No ice. Remember, ice is for preserving dead people. That's fine. We don't put it on our joints.
Keeping you from moving.
Yeah, yeah. It's not a great thing.
Exactly.
So,
Not.
but,
It slows the healing right down. Whatever relief you're getting from ice is very, very temporary. So if you want a very, very temporary relief at the cost of like a much slower healing process, then
absolutely. I mean, it can help with pain. Absolutely, we know that. But in terms of what it does to slowing healing down, it can significantly slow your recovery down, which people don't realize. So
yeah.
but you can do the heat and cold. That I think is quite nice.
Okay, yeah.
It's finished with the heat.
Yeah, finish with you.
You get the constriction and the dilation. So I do 5 minutes of each, but always finish with the heat to get it warm, and that can be quite soothing. Yeah.
Sure.
Don't ever put ice straight onto the skin, because that's also not good.
Yeah. So we're spreading a lot of good info here. So anyone should hopefully you're able to learn some more, and some more questions. How long is the training? So typically, Rich has been teaching for like 2 days and 3 days at a time, and Dan will usually join him for bigger classes, which means you get two of them teaching, and they're coming around. And it's very, very hands-on. But what you find then is a bit of practice then to get really good at it. I've done a couple. You've done one, and I've actually done four. But that's just
I've
because
done
no, maybe more than one.
no, I've done two. I've done two of his. Had lovely couple of weekends in Amsterdam with the group, which was great, and then also he's got his extra courses online, and I've done some of those as well. So yeah, we were supposed to go to Paris, weren't we, this year? Sorry, last year we were supposed to go to Paris for another train.
I had booked New York, and then somebody was talking about Paris, and I was like, gosh, maybe I should. And I was just looking, I got to go to New York because it was in February, and that was before everything shut down. So it actually all worked out in the end. But yeah.
It's a lovely excuse to go away. Oh no, I've got to go to New York for the weekend.
Yeah, so the online courses have been a good substitute, but really learning in person gives you a better grounding, especially for neck and shoulder points. You kind of need to see those ones in person because of the anatomy of the area. But once you've done the baseline ones, it's great to keep going with the online, and
also to have it done to you as well. I mean, doing the classes, having we swap where
feel like, and then you can go back knowing exactly what the patient's going to experience and describe it for them, what it should and shouldn't feel like, all of this. So it'll be much slower to learn it if you're learning from the start online, but hopefully now things will start opening up again, and we'll be able to travel again. soon.
Hopefully,
Hopefully,
hopefully.
we should stay hopeful anyway. But
Yeah,
yeah,
yeah.
that's it.
Good.
So thank you very much for
That's
joining
all right.
us, and we
You're
might
welcome.
do
Nice to
another
have a quick chat.
time soon. But yeah, that was really great, and I hope everyone watching enjoyed and found it interesting. So, oh my screen keeps going dark. Okay, great. So we will say